You're just tearing tissue, but it lets you see. I mean, one of the old surgical rules is don't cut through anything you can't see through, because there could be a nerve or a vessel hiding in there. So I really think we've got all the tumor, and we're just cutting the attachments. That little string could be tumor, couldn't it?
Going down. Oh, yeah.
Yeah, so, tell you what, I'm gonna grab that too. I think I'll trade, well, let's see. Yeah, this looks pretty good up here. That could be a little more tumor right there. Tell you what, let's work on this, and then we'll get back to that other place.
The thing is bigger than it looked like it was, so.
It's bigger than it felt. For me, at least.
Well, we've kind of misshapen it too. It was sort of laying there flattened out, you know.
Yeah.
That's a really tough.
Mm-hmm, it is tough. And that's why I'm letting you do it, is just so you get to feel the consistency of it. And after you spread a piece and you can see that that right there doesn't have any fat in it, you could snip that if you
Okay,
wanted to.
so it's tough.
Yeah,
piece for you.
just, so it's a combination of sharp and blunt dissection.
Okay.
And it's gradually just freeing it up. You're
Yeah, 'cause
doing
it's getting,
perfect.
like, right there.
Yeah, yeah, good. And you get good surgical technique. Yeah, there you go. That's really freeing it up. Okay. And see, so there's no more tumor in here for sure. But this piece right there, we ought to get.
Is that muscle?
So-
kind of seen down
Uh,
there? Yes.
more just connective tissue, you see? You could snip some of that, just cut that right. And freeing it up a little more. Yeah, I would like to get that. So I need to just change. See if I can grab a hold of that way down in there. I'm gonna get. Tell me if this hurts, okay? We're getting kind of far away from where we put the numbing medicine in. Let me see if I can just deliver that a little bit into the wound. Yeah, I think that probably is part of it. So let's dissect right around that. Just put the scissors right down in there and just, yeah, there you go. Just separate. You're freeing up without making our skin hole really any bigger. A little bit over here. I think this would probably be the last part of it.
Well, he's not making a face yet.
To the
Oh, he's
tickles.
now.
It tickles.
The fact that this hasn't grown in many years, or it's only grown very slightly, and it looks like a lipoma, means I'm not worried. That's probably just normal fat, but we'll go ahead and remove that anyway. So just work around it, and it's almost done.
Keep doing this.
Yeah, you can just use combination of sharp and blunt. I think this is the tumor, and that was just a little fat that was attached to the stalk. But it's good to get rid of it, just in case. Different consistency of this and that. With your finger, feel how soft that is. Feel how firm this is. See the difference?
Oh, yeah.
Yeah. So this is fat and this is lipoma. Okay, we're just about
Yeah.
done.
It's coming apart pretty good.
Yep.
So I can cut that now, right?
Yeah, I think so. Yeah, when you can see through it, then
Are you asleep yet?
just about done, Charles. And then we're going to just wash this out a little bit and put a couple of stitches in it, and you're out the door. Good, now you got it. Yeah, see, that's just fat. Really wasn't a tumor after all, but I wasn't sure, so.
It's better to check for sure.
So now we just got to finish this last little part. You can cut through that.
Yeah. That's good. How low should I go on this? Right here or lower?
Wherever. Just as long as you're getting, as long as all the tumor comes out and none of it goes back in. Does that
Felt
hurt?
that one?
Yeah.
Oh, we're almost done. Oh no.
We're almost ready to win.
Yeah. Yeah, yes, I just say just basically cut it off right